41. What is the primary source of energy loss in myocardial infarction? A. Glucose depletion. B. Oxygen deprivation. C. Fatty acid reduction. D. Electrolyte imbalance. Answer: B. Oxygen deprivation. Rationale: oxygen deprivation from coronary occlusion in MI halts aerobic metabolism, leading to energy loss and cell death. Glucose and fatty acids require oxygen for energy production, and electrolytes affect conduction, not energy directly. B is correct. 42. Which condition is a non-modifiable risk factor for MI? A. Hyperlipidemia. B. Age. C. Smoking. D. Obesity. Answer: B. Age. Rationale: age is a non-modifiable risk factor for MI, as risk increases with advancing age due to cumulative vascular damage. Hyperlipidemia, smoking, and obesity can be modified through intervention. B is correct. 43. A patient with MI reports nausea and vomiting. This is likely due to A. Medication side effect. B. Vagal stimulation. C. Dehydration.
D. Food poisoning.
Answer: B. Vagal stimulation. Rationale: nausea and vomiting in MI result from vagal stimulation due to inferior wall ischemia or pain response. Medications may cause it later, dehydration is a consequence, and food poisoning is unrelated. B is correct. 44. Which EKG lead monitors the inferior wall during an MI? A. V1. B. 2.
C. V5.
D. AVL. Answer: B. 2. Rationale: lead 2, along with 3 and AVF, monitors the inferior wall, often affected by right coronary artery occlusion. V1 is anterior, V5 is lateral, and AVL is high lateral. B is correct. 45. What does an elevated CKMB level indicate in MI? A. Liver damage. B. Myocardial injury. C. Kidney failure. D. Skeletal muscle trauma. Answer: B. Myocardial injury. Rationale: CKMB is specific to myocardial injury in MI, rising with necrosis. It's less specific than troponin but still diagnostic. Liver, kidney, and skeletal muscle involve other markers. B is correct. 46. Which medication is used to prevent reinfarction post-MI? A. Nitroglycerin. B. Clopidogrel. C. Morphine. D. Alteplase. Answer: B. Clopidogrel. Rationale: clopidogrel, an antiplatelet, prevents reinfarction by inhibiting platelet aggregation long-term. Nitroglycerin relieves pain, morphine manages acute symptoms, and alteplase dissolves clots acutely. B is correct. 47. Which complication of MI can lead to mitral regurgitation? A. Ventricular aneurysm. B. Papillary muscle rupture. C. Pericarditis. D. Cardiogenic shock. Answer: B. Papillary muscle rupture. Rationale: papillary muscle rupture post-MI disrupts mitral valve function, causing regurgitation. Aneurysms affect wall motion. Pericarditis causes inflammation, and shock is pump failure, none directly tied to regurgitation. B is correct. 48. What is a key public health strategy to prevent MI? A. Annual stress tests. B. Smoking cessation programs. C. Mandatory ECGs. D. Vitamin supplements. Answer: B. Smoking cessation programs. Rationale: smoking cessation programs reduce MI incidence by targeting a major risk factor, benefiting populations broadly. Stress tests and ECGs are diagnostic, and vitamins lack evidence for primary prevention. B is correct. 49. What does ST elevation in leads 2, 3, and AVF indicate in MI? A. Anterior wall MI. B. Inferior wall MI. C. Lateral wall MI. D. Septal MI. Answer: B. Inferior wall MI. Rationale: ST elevation in 2, 3, and AVF points to an inferior wall MI, typically from right coronary artery occlusion. Anterior V1, V4, lateral I, AVL, V5, V6, and septal V1, V2, MIs affect different leads. B is correct. 50. What initiates myocardial necrosis in MI? A. Plaque buildup. B. Prolonged ischemia. C. High blood pressure.
D. Coronary spasm.
Answer. B. Prolonged ischemia. Rationale. Prolonged ischemia from blocked blood flow in MI causes oxygen deprivation, leading to myocardial necrosis. Plaque buildup sets the stage, pressure contributes, and spasms are transient, but ischemia is the key trigger. B is correct. 51. Which drug class is used to reduce myocardial oxygen demand post-MI? A. ACE inhibitors. B. Beta blockers. C. Calcium channel blockers. D. Statins. Answer. B. Beta blockers. Rationale. Beta blockers reduce heart rate and contractility, lowering oxygen demand post-MI. ACE inhibitors improve remodeling, calcium channel blockers dilate vessels, and statins lower cholesterol, but B directly addresses demand. B is correct. 52. An elderly patient with MI reports fatigue instead of chest pain. This is A. Normal aging. B. Atypical presentation. C. Hypochondriasis. D. Unrelated illness. Answer. B. Atypical presentation. Rationale. Fatigue instead of chest pain is an atypical MI presentation, common in the elderly due to altered pain perception. It's not normal aging, hypochondriasis, or unrelated, it's MI-related. B is correct. 53. Which imaging modality is used emergently to guide MI treatment? A. Echocardiogram. B. Coronary angiography. C. MRI. D. Chest X-ray. Answer. B. Coronary angiography. Rationale. Coronary angiography is used emergently in MI to visualize blockages and guide PCI. Echocardiogram assesses function. MRI is detailed but slow, and X-ray is nonspecific. B is correct. 54. What is the goal of heparin in MI treatment? A. Dissolve clots. B. Prevent clot extension. C. Relieve pain. D. Lower cholesterol. Answer. B. Prevent clot extension. Rationale. Heparin, an anticoagulant, prevents clot extension in MI, stabilizing the thrombus. Thrombolytics dissolve clots, and heparin doesn't relieve pain or lower cholesterol. B is correct. 55. Which post-MI complication is indicated by a new systolic murmur? A. Ventricular septal rupture. B. Heart failure. C. Pericarditis. D. Aneurysm. Answer. A. Ventricular septal rupture. Rationale. A new systolic murmur post-MI suggests ventricular septal rupture, allowing blood shunting. Heart failure causes dyspnea, pericarditis a rub, and aneurysms are silent unless ruptured. A is correct. 56. Which lifestyle factor should be avoided to prevent MI? A. Regular exercise. B. High-fat diet. C. Stress management. D. Adequate sleep. Answer. B. High-fat diet. Rationale. A high-fat diet, especially saturated and trans fats, increases MI risk by promoting atherosclerosis. Exercise, stress management, and sleep are protective. B is correct. 57. What finding suggests acute MI on physical exam? A. S3 gallop. B. Jugular vein distension. C. Cool, clammy skin. D. Wheezing. Answer. C. Cool, clammy skin. Rationale. Cool, clammy skin in acute MI reflects sympathetic activation from pain and ischemia. S3 and JVD suggest heart failure, and wheezing is pulmonary, not specific to acute MI. C is correct. 58. What is the purpose of statins post-MI? A. Reduce blood pressure. B. Lower LDL cholesterol. C. Prevent arrhythmias. D. Increase oxygen supply. Answer. B. Lower LDL cholesterol. Rationale. Statins lower LDL cholesterol post-MI, stabilizing plaques and reducing reinfarction risk. They don't directly affect BP, arrhythmias, or oxygen supply. B is correct. 59. Which risk factor is linked to MI through insulin resistance? A. Hypertension. B. diabetes mellitus. C. Smoking. D. Sedentary lifestyle. Answer: B. Diabetes mellitus. Rationale: diabetes mellitus increases MI risk via insulin resistance, promoting atherosclerosis. Hypertension, smoking, and sedentary lifestyle contribute differently, not via insulin resistance. B is correct. 60. What EKG finding in leads V7, V9 suggests a posterior MI? A. ST elevation. B. ST depression in V1, V3. C. Q waves in V1, V4. D. T wave inversion. Answer: B. ST depression in V1, V3. Rationale: posterior MI shows ST depression in V1, V3 anterior leads due to reciprocal changes from posterior ST elevation, seen in V7, V9. Direct ST elevation isn't visible in standard leads, and Q waves or T inversion are later findings. B is correct. 61. Which patient is at highest risk for myocardial infarction? A. 25-year-old athlete. B. 60-year-old smoker. C. 40-year-old vegan. D. 30-year-old with anxiety. Answer: B. 60-year-old smoker. Rationale: a 60-year-old smoker has the highest MI risk due to age, non-modifiable, and smoking, major modifiable factor, both accelerating atherosclerosis. Younger patients with healthier profiles or anxiety alone have lower risk. B is correct. 62. Which lifestyle factor contributes to MI by increasing blood pressure? A. Smoking. B. High sodium intake. C. Sedentary lifestyle. D. Alcohol moderation. Answer: B. High sodium intake. Rationale: high sodium intake raises blood pressure, a key MI risk factor, by stressing vessels and promoting atherosclerosis. Smoking affects vessels differently. Sedentary lifestyle reduces fitness, and moderate alcohol may be neutral. B is correct. 63. What atypical MI symptom is more common in diabetic patients? A. Chest pain. B. Shortness of breath. C. Arm pain. D. Jaw pain. Answer: B. Shortness of breath. Rationale: diabetics often present with atypical MI symptoms like shortness of breath due to neuropathy masking pain. Chest, arm, and jaw pain are classic but less prominent in this group. B is correct. 64. Which EKG finding requires immediate intervention in MI? A. New Q waves. B. Ventricular tachycardia. C. T wave inversion. D. First-degree AV block. Answer: B. Ventricular tachycardia. Rationale: ventricular tachycardia in MI is life-threatening, requiring immediate intervention, e.g., defibrillation, due to risk of cardiac arrest. Q waves, T wave inversion, and AV block are concerning but less urgent. B is correct. 65. What does a rising troponin level over 6 hours indicate in suspected MI? A. Stable angina. B. Acute MI. C. Pericarditis. D. Pulmonary embolism. Answer: B. Acute MI. Rationale: rising troponin over 6 hours indicates acute MI due to ongoing myocardial necrosis. Stable angina doesn't elevate troponin. Pericarditis has different markers, and pulmonary embolism affects D-dimer, not troponin. B is correct. 66. Which medication should be avoided in MI with right ventricular involvement? A. Aspirin. B. Nitroglycerin. C. Clopidogrel. D. Metoprolol. Answer: B. Nitroglycerin. Rationale: nitroglycerin is avoided in right ventricular MI as it reduces preload, worsening hypotension in a preload-dependent state. Aspirin, clopidogrel, and metoprolol are safe if BP is stable. B is correct. 67. Which complication of MI is most likely within the first 24 hours? A. Heart failure. B. Ventricular fibrillation. C. Dressler syndrome. D. Ventricular aneurysm. Answer: B. Ventricular fibrillation. Rationale: ventricular fibrillation is most likely within 24 hours post-MI due to acute ischemia causing electrical instability. Heart failure develops later, Dressler's is weeks out, and aneurysms take time. B is correct. 68. What is the recommended daily aspirin dose for MI prevention? A. 81 milligrams. B. 325 milligrams. C. 500 milligrams. D. 1000 milligrams. Answer. A. 81 milligrams. Rationale. 81 milligrams, low dose. Aspirin is recommended for MI prevention, balancing antiplatelet benefits with bleeding risk. Higher doses increase bleeding without added benefit. A is correct. 69. What does ST elevation in lead AVR with widespread ST depression suggest? A. Left main occlusion. B. Inferior MI. C. Lateral MI. D. Posterior MI. Answer. A. Left main occlusion. Rationale. ST elevation in AVR with widespread ST depression indicates left main or severe multivessel occlusion, a critical MI scenario. Other options involve specific lead patterns, not this global change. A is correct. 70. What cellular change occurs in MI due to lack of oxygen? A. Increased ADP production. B. Anaerobic metabolism. C. Enhanced contractility. D. Reduced inflammation. Answer. B. Anaerobic metabolism. Rationale. Lack of oxygen in MI shifts cells to anaerobic metabolism, producing less ADP and lactic acid, leading to injury. ADP decreases, contractility drops, and inflammation increases. B is correct. 71. Which thrombolytic is commonly used in MI if PCI is unavailable? A. Heparin. B. Alteplase. C. Warfarin. D. Clopidogrel. Answer. B. Alteplase. Rationale. Alteplase, a thrombolytic, dissolves clots in MI when PCI isn't available. Heparin prevents clot growth. Warfarin is long-term, and clopidogrel is antiplatelet, not thrombolytic. B is correct. 72. A patient with MI report shoulder pain. This is an example of A. Musculoskeletal injury. B. Referred pain. C. Anxiety reaction. D. Medication side effect. Answer. B. Referred pain. Rationale. Shoulder pain in MI is referred pain due to shared nerve pathways with the heart. It's not musculoskeletal, anxiety-related, or a drug effect in this context. B is correct. 73. Which diagnostic test is least useful acutely in MI? A. Troponin levels. B. EKG. C. Echocardiogram. D. Stress test. Answer. D. Stress test. Rationale. Stress tests are contraindicated acutely in MI due to risk of worsening ischemia. They're used for pre-diagnosis. Troponin, EKG, and echocardiogram are critical acutely. D is correct. 74. What is the primary benefit of ACE inhibitors post-MI? A. Reduce clot formation. B. Improve ventricular remodeling. C. Increase BP. D. Relieve chest pain. Answer. B. Improve ventricular remodeling. Rationale. ACE inhibitors improve ventricular remodeling post-MI by reducing afterload and preventing dilation. They don't affect clots, raise BP, or relieve pain directly. B is correct. 75. Which MI complication causes a friction rub on auscultation? A. Cardiogenic shock. B. Pericarditis. C. Ventricular rupture. D. Heart failure. Answer. B. Pericarditis. Rationale. Pericarditis post-MI causes a friction rub from inflamed pericardial layers rubbing together. Other complications don't produce this sound. B is correct. 76. Which dietary component helps prevent MI by lowering cholesterol? A. Saturated fat. B. Fiber. C. Sugar.
D. Sodium.
Answer. B. Fiber. Rationale. Fiber lowers cholesterol by binding bile acids, reducing atherosclerosis risk and thus MI. Saturated fat raises cholesterol, sugar, and sodium don't directly affect it. B is correct. 77. What is a critical nursing action during an acute MI? A. Encourage ambulation. B. Administer oxygen. C. Delay EKG. D. Restrict fluids. Answer. B. Administer oxygen. Rationale. Administering oxygen is critical in acute MI to improve myocardial oxygenation and reduce ischemia. Ambulation is unsafe, delaying EKG is harmful, and fluid restriction is unnecessary. B is correct. 78. What is the mechanism of nitroglycerin in MI? A. Reduces afterload. B. Increases preload. C. Dilates coronary arteries. D. Prevents thrombus formation. Answer: C. Dilates coronary arteries. Rationale. Nitroglycerin dilates coronary arteries in MI, improving blood flow and oxygen delivery. It reduces preload, not afterload, and doesn't affect thrombi. C is correct. 79. Which condition increases MI risk by promoting plaque buildup? A. Anemia. B. Hyperlipidemia. C. Hypothyroidism. D. Asthma. Answer: B. Hyperlipidemia. Rationale. Hyperlipidemia promotes plaque buildup by increasing LDL cholesterol, a key MI risk factor. Anemia reduces oxygen, hypothyroidism affects metabolism, and asthma is unrelated. B is correct. 80. What EKG change in leads I and AVL suggests a lateral wall MI? A. ST elevation. B. ST depression. C. Q waves. D. Flat T waves. Answer: A. ST elevation. Rationale. ST elevation in leads I and AVL indicates a lateral wall MI, often from circumflex artery occlusion. ST depression is reciprocal, Q waves are later, and flat T waves are nonspecific. A is correct.